Give an overview. What is COPD and emphysema, please?
Well, I figured I'd break it down for you as simply as possible so you could understand what COPD is. But just to start, approximately 6% of the adult population in the United States are considered to have COPD, which is a large number. As far as mortality,
Objection, Your Honor. Narrative.
Sustained.
There's about 100.
Here, you have to hold on 1 second. What's the mortality related to COPD?
The death rate.
Death rate.
How many people annually die? It's estimated that about 120,000 die per year from COPD. And COPD is considered in the United States the third leading cause of death in the United States, which is quite significant. If we look at the impact in my practice or what we see in the country, there's about 8 million people considered to have COPD. These 8 million people find their way to doctors' offices through the course of the year. As far as how many go to the ER, there's about 1.3 million. And of those, about 670,000 get hospitalized.
Next question.
That's the impact.
Next question.
All right, doctor. And so that's the overall impact. I want to talk about what the disease is, and if you can explain it to the jury as far as how COPD is classified.
It's classified into two subtypes: chronic bronchitis and emphysema.
Next question.
All right. Tell us a little bit about chronic bronchitis.
Chronic bronchitis is a clinical diagnosis, and it involves the airways. Emphysema is a pathologic diagnosis, and it involves the lung itself. So they are different in terms of where they manifest themselves on the body.
How does a doctor diagnose COPD? How is it diagnosed?
It's diagnosed with symptoms, so you have to have a clinical index of suspicion, and then you have to do what's called a pulmonary function test.
What is a pulmonary function test?
It's a breathing test where you basically you go into a cubicle, you take a deep breath in and you blow out, and we measure those flows, and we measure if they're what they're supposed to be. And there is a norm, and we compare you to that norm. And that's called your percent predicted. So we have a predicted part of what you should be, we have an actual part of what you are, and then we say, how do you compare to that? And that gives us an idea of how the severity of the disease. So we do a PFT for 3 reasons: for diagnosis, and it's crucial for the diagnosis. It's the cornerstone of the diagnosis. We do it to see the severity, so we could say where you're at, bad or mild. And then we could also follow the progression of the disease. So if you do this test annually, you'll be able to see what trend the patient's going in.
And and I had asked a little bit this before. You said COPD is the leading cause of smoking is the leading cause of COPD. What percentage, in your opinion, would be that of smokers, or excuse me, of people with COPD? What percentage of those people was smoking the cause of their COPD?
85%.
Okay. What are some of the other exposures that could cause COPD?
Well, COPD in America is tobacco smoke. If you look at the world, some of the people in sub-Saharan Africa and some underdeveloped countries have to use biomass fuels to cook. They may use coal, poorly ventilated areas. So people like that may get COPD from being exposed to these products. But here in America, it's tobacco smoke. And there's environmental factors such as dust and fumes. There's genetic factors in terms of how we metabolize some of the insult of the tobacco smoke and some of the physiologic things that go along with that.
What are the symptoms of COPD?
The main symptom is cough.
I'm sorry, the main symptom is
Cough.
Thank you.
The second symptom, and this could be productive or non-productive. And then the second most common symptom would be shortness of breath, and that could be at rest in severe cases or with exertion early on.
Any other symptoms that are associated with COPD?
Well, as you get in advanced disease, there could be wheezing, there could be fatigue, weight loss. You could cough up blood sometimes, but those are the main symptoms.
Does COPD happen overnight?
No, it's a progressive disease.
What does that mean?
It's slow to accumulate. As these insults happen to the body, the lungs have enough resilience that you can really give them a beating, so to speak, with tobacco smoke, and they'll slowly decline. The annual rate of decline for normal people who don't smoke and don't have any obvious risk factors, if you will, is about 25 to 30 cc's per year, which is basically a tablespoon is 15 cc's. So basically you're losing somewhere around 2 tablespoons of lung function every year, if you could imagine a tablespoon. If you smoke, there's been some reports that it could go up to 100 to 150 cc's per year. So you can see where smoking could cause that much of a decline in your lung function as you smoke.